Step 29, preparation for egg collection. You have done your ovarian stimulation and you had a trigger shot. Now next 36 hours you need to wait for your egg collection procedure. During this period, you need to go through this checklist to make sure that you are prepared for the procedure, because you need to reduce your chance of cancellation, and also you need to reduce stress on the day. So when you have an instruction for trigger, your clinic sends following instruction. Usually they explain to you over the phone, and also they send it in writing by email or text message. So that those instructions should contain following items. If not, then you need to check with your clinic. First, you need to know exact date for your procedure. Second, you need to know exact address of the clinic where you will be having procedure, because some clinics may have multiple sites. You need to know exactly which clinic you're going to for egg collection. So third is the fasting instructions and fasting time. So egg collection is done normally under general anesthetic. Even if you're having egg collection under sedation, you need to fast at least for 6 hours, which means you should not eat any solid within 6 hours leading up to your egg collection procedure. Even if you add a little bit of milk to your tea or coffee, that's considered solid. You cannot drink tea, or you can't drink any coffee. So you are allowed to drink plain water without any additives, just plain water for up to 2 hours before your egg collection procedure. But you strictly should follow your clinic's instruction, because it may vary for egg collection fasting. You need to know admission time, and you need to know procedure time, and you need to know discharge time, so that you can plan around it. Then you will have a pre-op assessment. Usually pre-op assessment is done by anesthetic team or theater team. So they can do assessment sending you questionnaire, or doing phone call, or in person. So essentially, main items on this assessment is they check your BMI, body mass index. They check your medical history to find out if there's any medical problems in the history which may cause problem on the day of egg collection. Previous surgeries, if you had any problems during those surgeries. Previous anesthetic history, if you had any general anesthetic, if you had any complications, any problems during or after anesthetic, and also your allergies. That's very, very important to do this pre-op assessment. Then once it's done, you need to go through your own checklist. Checklist in terms of your mental health, whether you're emotionally ready. If not, you need to speak to the clinic. And with your physical health, to make sure that you don't have any chest infection or flu, you physically feel fit for the procedure. Then you need to go through the financials, whether you need to pay on the day of a collection, or whether you need to pay beforehand, and all the logistics of traveling to the clinic, and also parking. All these things you need to check and prepare, so that on the day you don't have any stress, and you have a very straightforward egg collection procedure.